Underactive adrenal glands, or adrenal insufficiency. The adrenal glands are like top hats on the kidneys. Their job is to produce different kinds of steroid hormones, most notably cortisol and adrenaline. These hormones are necessary for life because they regulate stress responses that control blood pressure as well as how our bodies use glucose. An underactive adrenal gland is called adrenal insufficiency, and this can be from different causes. The first cause would be long-term use of medications like prednisone, hydrocortisone. This can put the adrenal gland to sleep. Sometimes a careful wean from the medication can wake them up again. A tumor or injury in the pituitary gland in the brain can squish the cells that tell the adrenal glands to do their job, so ultimately the adrenal won't produce hormone. A stroke in the adrenal or in the pituitary gland can shut down hormone production, and this is an emergency. Surgical removal of adrenals or pituitary gland for any reason, and an autoimmune disease that attacks the adrenal glands so that they cannot function. It's important to know that adrenal insufficiency is a serious condition and requires treatment for the patient's safety and health. This is not the so-called adrenal fatigue, for which there is no biochemical evidence and is not a diagnosis recognized by any professional endocrine society. What does adrenal insufficiency feel like? The classic examples include an unintentional weight loss, poor appetite, nausea, low blood sugar, low blood pressure, fatigue, and a feeling of malaise. Sometimes the skin will get darker. The patient may look tan, or lines on the palms will darken, or the gums may darken. How do we diagnose adrenal insufficiency? We look to see if there are medications on the patient's list that could cause adrenal glands to be underactive. We remove these medications if appropriate. A cortisol level measures adrenal function, and it should be at its highest at 8 o'clock in the morning. If this number is less than 5, we have to figure out why the adrenals are underactive. An ACTH level measures how hard the pituitary gland is asking the adrenals to make cortisol. If cortisol is low, a normal response would be a very high ACTH. If ACTH is low or inappropriately normal, then the pituitary gland isn't doing its job and we have to figure out why, usually by doing an MRI of the brain and measuring other pituitary hormones. If cortisol is low and ACTH is high, we may do a CT scan of the adrenal glands and check certain antibodies. Once adrenal insufficiency is diagnosed, what do we do about it? If there's an underlying reason for this, we try to resolve that problem so the adrenal glands can then go back to normal. If the antibodies are positive, this is called Addison's disease, but there is no treatment for the autoimmune condition itself, and patients must take hormone replacement. If the hormones need to be replaced, this can be done easily with pills: hydrocortisone, prednisone, and fludrocortisone, depending on the patient's needs. If hormone replacement is needed, the patient must know that this medication is required for life, and he or she cannot miss any doses. If the adrenal glands have simply gone to sleep, we usually switch the steroid to hydrocortisone and slowly taper off. Be patient, because this can take months or even a year. We always do lab tests to be sure adrenal glands are recovered before stopping medication. How do you take steroid hormones? Well, we got to do our best to mimic the body's natural rhythm for cortisol as closely as possible. So hydrocortisone is taken twice a day. The largest dose is first thing in the morning, and the second dose will be in the early or mid-afternoon. If the patient needs fludrocortisone, that's taken once daily in the morning. If the patient uses prednisone, this is usually only once a day. What is stress dosing? When a patient with adrenal insufficiency is sick, like they have the flu, for example, They have to double the dose of the hydrocortisone every day for the duration of the illness. Afterward, they can go back to the normal dose. If a patient has surgery or is in the hospital, we may need to use other special doses of steroids. So we will make a plan about what steroids you take, how we will taper it if appropriate, what the maintenance dose is, and what the stress dose is. And what about an emergency? All patients with adrenal insufficiency should have a medical bracelet. This can alert first responders to their condition in case he or she is found unconscious. If the patient becomes acutely ill with nausea and vomiting and is unable to take the usual pills for steroid replacement, he or she must use dexamethasone injection or a Solu-Cortef injection kit for emergency hormone replacement. This is not the solution, but only a temporary stopgap. So once the injection has been taken, the patient must go to the emergency room for treatment. And what if the patient still feels poorly after we have treated this problem? Once the patient has normal blood pressures and the labs show us they have good levels of glucose, electrolytes, and cortisol, we know we have controlled the adrenal insufficiency, and we do not further adjust steroids. A primary care doctor can investigate other causes for persistent symptoms, which can be quite common. When you have questions about this topic, the National Institutes of Health has an excellent section on adrenal insufficiency, and the Mayo Clinic as well. I also include a reference for an article about adrenal fatigue and how it is not a medical condition.